We are going to focus on sensory processing. Sensory processing or integration is the organization of information from the senses to use in your daily life. At the moment, you are using your hearing sense to learn more. At the same time, you might be ignoring or trying to ignore other stimuli that does not support your learning, perhaps something distracting in the environment. However, if you were to smell smoke and hear a fire alarm, your brain would automatically pay attention to this and ignore the presentation. This process happens continuously and often happens automatically. Sensory processing challenges can impact on your child's ability to participate in self-care, play, social interactions, and learning. We depend on sensations to experience the world, to achieve comfort, and to learn new skills. It keeps us safe by ensuring that we are able to respond to danger by using our fight and flight response. Young children's sensory processing skills are still developing, and your child might have a different response to sensory input and perhaps respond what we perceive as inappropriately with a fight and flight response. Young children have immature nervous systems that will develop over time and will mature. In the meantime, we can support them, and everybody has their own sensory preferences. We are now going to discuss the 8 sensory systems and briefly discuss what it might look like for your child and how you can support them. And we're going to start off with vision. Some children might be oversensitive to bright lights. They might need sunglasses, softer lighting, or perhaps a hoodie. Some children might need more visual supports to support their learning and to help them to attend to what's important. Some children might find it hard to focus when there are lots of other distracting stimuli. And the strategy that will be supportive here is to declutter or cover up so that only the activity that they need to attend to is visible. The next sense is sound. Some children are sensitive to noise and they would be covering their ears or complaining or getting upset when there's noise. You can support them by giving them ear defenders, trying out earplugs or headphones, and then gradually exposing them to sound within their tolerance. Touch is a tricky one. There are lots of children that get upset during personal care tasks, such as bathing, washing, having their hair brushed, having their nails cut, because they are oversensitive to touch. Giving your child a countdown during such an activity can be helpful because your child knows when the activity is coming to an end. 10, 9, 8, and so on. It can be helpful if you can give your child control of the activity. And then lastly, deep pressure is very helpful. The touch sense, the light touch sense is highly sensitive and can be dampened down by the deep pressure touch sense, which uses a different sensory pathway to the brain and helps to dampen down intolerable input, intolerable touch. And then another way differences in touch can present is by your child seeking deep pressure, coming to you for lots of deep squeezes or hugs. And if that's what they're looking for, give them more of that. That's exactly what they need. Next, we're going to focus on the mouth, and there are 2 ways that this can present. Your child may be seeking extra stimulation in the mouth. They might be biting things, might be chewing on things, or perhaps they're sucking on things, and this is very calming for them. Therefore, they need more of that, but it's understandable that you might not want them sucking on their clothes or perhaps on different appliances because of hygiene. There are oral motor toys that can be helpful in this, and there are oral motor activities that can be done. So please do ask for advice at the advice clinic if this is an area that you would like to explore. The other thing that can happen with the mouth is that the taste buds in the tongue can respond to food. And your child might have a limited range of diet, be a picky eater, and perhaps prefer bland food. The other senses are very involved with eating, how appetizing the meal looks, what type of brands your child likes, and of course the smell, and then the texture as well, the touch of the food. So there can be many sensory reasons why your child may have a restricted diet or have picky eating. Messy play is a great strategy to use because it helps to desensitize those other senses before you get to the mouth. So your child is seeing it, is smelling it from a distance, is touching it with their hands, and desensitizing in a safe way. We do also have a fussy eating webinar that you are welcome to get the link for. Then as the sense smell is next, and that's also closely linked with fussy eating. Sometimes it can be the smell of food that causes fussy eating. Another way that smell can present is that your child seeks out all sorts of smells and smells objects. And if this is the case, give them more of that. Give them lots of messy play with different smells and different sensations that they can be exposed to through cooking and baking. If your child is oversensitive to smell, like bath products and products that we use in our daily life, perhaps certain smells need to be limited, and that's where a chat with your preschool teacher might be helpful. And in your home, you would naturally be reducing the type of smells that your child finds difficult. Ventilation helps a lot, and sometimes masking an unpleasant smell with a nice smell can help as well. There are further senses that you may not be that familiar with, and I'm going to start off with the vestibular sense, the movement sense. It is in your inner ear canals that you have fluid moving when your head moves. So what I would like you to do now is to drop your chin slowly to your chest. Now slowly and gently tip your head up and backwards. And by doing this simple head movement, you have stimulated your vestibular sense. Your child's vestibular sense could be overly sensitive, and they would avoid movement if that's the case. They would easily feel dizzy or travel sick. And the natural tendency is for your child to avoid movements that are unpleasant for them, and gradual grading within your child's tolerance level is the way to go with this, with them always feeling safe. Another way that the vestibular sense can present as a challenge is your child's increased need for movement and really being hyperactive and on the go. They want more stimulation, and that's what you need to do then as your supportive strategy is give them more of the sensations that they're looking for. The next sense then is your proprioceptive sense. This is stimulated when your muscles and joints move and when you receive deep pressure. Where difficulties or challenges can present with proprioception is that your child might have difficulty judging the force that they use. You'll see that by them slamming doors, stomping up the stairs, and breaking things unintentionally just because they're using too much force. Another way this can present is with too little force. They're holding things too loosely. They're not using the right level of force. And then lastly, they can have a poor awareness of where their body is in space. They might bump into things, might look clumsy, and not be able to copy movements easily. For the proprioceptive sense, you need to give your child more push, pull, lift, carry, stretch, and deep pressure activities. The more you stimulate the proprioceptive sense, the more it develops and forms a better body map and learns how to use the correct force. And then lastly, it's the interoceptive sense. The interoceptive sense is your awareness of signals from the organs in your body and is closely linked to your emotions. If your child has difficulty in this area, they may not recognize when they're hungry, when they're thirsty, when their bladder or when their bowel is full, when they're in pain, when they're sick. They might have a high or a low tolerance towards these things, and they might have difficulty identifying and reporting when something is wrong in their body. And they might have poor awareness of their stress levels. We have a separate recording where you can delve deeper into the interoceptive sense. So please do ask your OT if you'd like the link for that. While generally your child's sensory preferences remain quite consistent, their tolerance or their threshold for less desired sensory inputs can fluctuate depending on many factors. How we process sensory information and how regulated we feel are directly related. Every sensory input is either calming or alerting for the nervous system. In this way, sensory processing influences regulation. When we are regulated or dysregulated, also influences how we process that information. When we are feeling dysregulated, our tolerance threshold for that type of input we might find challenging may be lower. Lack of sleep can affect your child's ability to process information and also integrate information from multiple senses. Poor sleep can heighten sensory sensitivities. Having a good diet can support regulation. For example, diets that are high in sugar and processed carbohydrates can increase sensory-seeking behavior. The environment can influence how regulated we feel. Every environment also presents its own sensory demands. The combination of the sensory inputs experienced may make less desired inputs more difficult to tolerate. Previous experiences and trauma can influence how we respond. Biologically, we are designed to remember negative experiences of sensory input. For instance, you won't poke your finger in a fire twice. If a child's experience of a negative experience towards a sensory input, like falling from a height or difficulty feeding as a baby, this can affect how they process that sort of sensory input going forward. And then sometimes a sensory sensitivity can be present from birth, like a child being sensitive to vestibular input. This makes them avoid certain movements and experiences, and as a result, they continue to have very low tolerance and poor responses to this type of input. And lastly, other factors such as having fears or phobias of certain sensory input for no obvious reason can affect how we process it. Our top sensory tips. Be a detective, a sensory detective. Observe your child's sensory behavior. What type of input do they naturally seek out? Give them more of this. What sensations do they avoid or upset them? Try to reduce it and grade their exposure. Providing predictable routine and environments can support your child to tolerate sensory information. Linear movements straight forwards and backwards is calming. Deep pressure touch is good. And proprioceptive heavy work, muscle work, is great for supporting regulation. Think, push, pull, lift, carry, stretch, deep pressure. Those are your go-to activities to help your child feel okay. Regulating activities. We're going to discuss some lovely ideas on how you can support your young child. Heavy work or weight-bearing activities such as tummy time, crawling, cruising, climbing, animal walks are very good. Activities where you get your child to push, pull, drag is good. Crawling through a tunnel, climbing up the couch. Play activities where you're doing fun games such as animal walking, obstacle courses, climbing frames, tug of war, using your playground equipment, jumping on a trampoline, and deep pressure activities. Getting your child to do a chore can be very, very helpful in regulating. Getting them to carry a small amount of shopping, cleaning a window, wiping a table, sweeping, carrying a school bag, for instance. Oral motor activities are very powerful. Getting them to take a drink, getting them to eat a crunchy or chewy snack, giving them something chewy to chew on, or giving them a blowing activity. And then lastly, your regulating environment could be a quiet space, giving your child a sensory toolbox, reducing the types of toys available, or using less words, and of course, nature. Regulation is the ability to respond to the sensory input in the environment in such a way that it meets your goal. For instance, being able to settle and wind down to fall asleep, to be able to enjoy the game you're playing, and so on. Strategies that support regulation is coaching your child in relation to naming and understanding big emotions and model and coping strategies. Oh, I think you're got anger in you right now. You look angry. Let's take some deep breaths. Acknowledging frustration. I can see this is tricky for you. We'll try your best. Set predictable and reasonable boundaries. First tidy, then toys. Give simple choices. Red or green sock. Help your child to wait. Yes, we can do that in 5 minutes. Pair that with a timer, which the visual cue would really help to support your child in waiting. At the moment, your child needs a lot of co-regulation from you to help them stay regulated. Staying calm is so very valuable. A quick and effective strategy to remain regulated yourself is through deep belly breathing. I'd invite you now to exhale and squeeze your tummy in as you breathe out. Take a deep breath in, and as you breathe in, allow your stomach to fill up like a balloon. And then as you breathe out all the air slowly. With each successive exhale and inhale, try to make the breathing deeper and slower. A tea break might be a good idea at this point. And if you decide to have a quick tea break and pause this presentation for the last slide, I would like you to be aware of your body and how it's processing the different sensations as you're making and enjoying your tea or coffee. Co-regulation is all about checking in with yourself. How are you feeling? I'd like you to think about what are your regulation strategies? What helps you to feel okay? Often we have our own sensory strategies to fill up our cups and take care of ourselves. Do you get time for self-care? And if not, perhaps it's time to make time. Thank you very much for listening. Take care.